Good morning and welcome to Business Beat with me, Odette, from the very bustling, busy city centre of Johannesburg. I'm at a Quadcare Clinic in Joburg CBD in Fox Street, and it is still September. We're still celebrating South African businesses, South African entrepreneurs, and South African brands that are doing amazing things during this Heritage Month. So join me as I meet with Dr Dulcy, who is the CEO and founder of the Quadcare Group of Clinics, to hear about what amazing work this South African is doing in the medical industry. So Dr. Dulcy, how many clinics are there in the Quadcare Group at the moment?
At the moment, we have 8 clinics across Gauteng.
Yes.
We're hoping to be at 15 before the end of next year, and have a solid footprint in Gauteng before we expand to the rest of the country.
Where are they? I know there's one in Alex, there's one here, there's Fox Street one.
There's the one in Braamfontein.
Yes.
We have a student one in the University of Johannesburg. There's one in Alex, there's one in Carltonville, there's one in Terfontein, and there's one in Meadowlands as well, in Edenvale.
Right, so basically where you find all underprivileged people,
Yes.
they have access to a Quadcare clinic so that they can get first prize or first level
Yes, medical
care.
Exactly,
Okay.
yes.
And Dr. Dulcy, you are a doctor, but you're also a businesswoman.
Yes.
Right? Do you still practice medicine, or are you?
I still practice medicine because, over the years, there's patients that have developed that relationship with
Of
me.
course.
Who would want to be, because patients sometimes find it very difficult to trust someone else.
Yes.
So I still do like that minimum level of care. My focus is now building the business, building the brand, building the people working in the brand, because without the people, the brand does not exist, especially if we say we are being accessible in providing quality health services. You want the people working in that brand to live that.
Where do you see the role of marketing? Do you do a lot of marketing?
Yes, marketing is very key, because especially because we are in the lower income market.
Right.
Our prices are much lower than your traditional GP. So you need a lot of people, to be coming to access the services for it to make business sense or financial sense.
Yes.
So marketing is really a big part of what we do. We focus a lot on social media, online marketing, just flyer distribution and posters in the communities that we are in, and just engaging the local communities.
And have you found that now during the coronavirus period,
Yes.
that your clinics have been busier than ever? Have you found it difficult to tell people that, or to get people to understand that if you feel like you have symptoms, stay at home, don't come to the clinic?
Do not come. In the beginning, especially your level 5, level 4 lockdowns.
Yes.
The impact, the negative impact of the COVID was really strong on the business. We had very few people, obviously going to work or having access to sources of income. Hence, they would even though the costs are minimal, they would not be able to afford them because they had no income. There was less traveling, so people were not coming to health services. So as things opened up, and we also started contracting with labs to provide COVID testing.
Right.
So we were able to be more accessible for those communities. People were able to find out their results quicker, and hence know how to protect their families as well.
And I know that Quadcare is also doing a lot of work with corporates, because
Yes.
even though people are employed at a company or in a corporate, not everybody earns enough to afford medical aid. Yes.
So how we work with companies is that we come and say, how many employees do you have? Are they on medical aid? If they are not, we are able to set up a clinic on site that the employees can access, that is paid for, by the company, or whatever arrangement they can make with the employees. That really obviously helps the companies in terms of managing absenteeism.
Yes.
But also for the workers, it's saying, here's healthcare that our company is providing for us. The employer takes care of us.
Course,
And it does a lot in building just the staff morale as well.
I mean, the facilities here are beautiful.
Thank you so much.
You walk through this clinic and you feel like you're in a private facility.
Exactly.
It's absolutely inspiring and wonderful work that you're doing.
Thank you so much.
To provide the standard of medical care to people who really often feel that they just can't afford, or that they are helpless, that
or just because they pay a lower amount, they should be treated
badly. Yes.
Exactly.
Your plans for the future?
It's expansion, you
Right.
know. Firstly, it's just growing the number of clinics. Like I said, we want to have 15 by next year. We want to have much more and across the country. We also like engaging retail brands, you know, to see if they can be part of that expansion, because it would make it easier for us to expand, you know, along a supermarket chain, you know, for instance.
That's
to say,
clever.
Exactly. You can be inside your premises in the communities that you're in, and then
Right.
you become more than just, you know, a supermarket.
It will definitely stimulate foot traffic.
Exactly. We also engage in like your taxi industries to see how we can work with, you know, the taxi associations in the
Right.
ranks that they exist in, to see if we can provide health services in those. Government as well, you know, is quite active in HIV care and circumcisions and, like, you know, preventative health care. You know, so we're trying to talk to government to see how we can be contracted for the communities that absolutely cannot afford.
Yes.
Then we can be like a free health services that is supported by the government.
And we know that even though we're all talking about coronavirus, HIV is still very prevalent.
Exactly, the chronic illnesses.
Absolutely,
you know, like your
diabetes,
hypertension, they have become neglected, but at the same time, people who have them are called vulnerable people. If they contract COVID, it is much more disastrous for them.
So, what advice would you give to an entrepreneur? I mean, whilst you are a doctor, you are definitely a hands-on businesswoman who is an entrepreneur who is building what would soon become an empire.
Yes,
you know?
hopefully, yes.
So what advice would you give to an entrepreneur who's looking to start some kind of franchise business or multiple stores that are branded with his or her product or company name? What advice would you give
I think
them?
it starts with the vision. You know, what are you trying to provide? Who are you providing that to? You know, and just going through that customer or, like, you know, the end receiver of your service and understanding what their needs are, you know, so that you are able to build it. And then the next would be the relationships, you know, because the money is quite limited. Like, not everyone has money out of their pockets to build an empire, for instance. It requires you building the good relationships, the right relationships. Having the right investors, you know, on board is really quite important, because especially for social entrepreneurs, sometimes you do get investors, but they will take you away from the vision or the mission or what you wanted to achieve. So making sure you get the right investors in place, the right leadership, the right company leadership in place, that will allow you, you know, to really grow and expand.
Did you study anything in business?
Yes.
Over and above your medical
Yes,
degree?
I'm actually quite educated.
I can tell. I can tell.
Yeah.
It's interesting because you're talking about all of the fundamentals of running a business, and I'm curious.
Okay.
Is it self-taught, or did you actually go to a business school and learn?
I did an MBA with the Gordon Institute of Business Science, GIBS. You know, so before that I had done like your HIV diplomas, sports medicine, travel medicine, occupational health. You know, because as I was coming along, my interest has always been working with companies. You know, for occupational health, it was about how do I develop policies and procedures that are health related for these industries, your mining,
for example,
logistics,
farming.
manufacturing, farming, such that their employees are safe. You know, because we all know the health risks that come with a lot of these businesses. So that was the thinking before, and then HIV, obviously, like especially in mining, is really a big issue. You know, after studying all those, I realized that I don't know much about business and I'm making a lot of mistakes, and also because I wanted to grow and expand.
I'm at a loss for words for how I admire you and how I am so impressed with the work that you are doing.
Thank you so
Keep
much.
on keeping on, and I hope to catch up with you sometime in the future.
Thank you so
when Quadcare has expanded to all the provinces across South Africa, and I can say I visited the first few, and now you're sitting in your empire, but most importantly that ordinary South Africans have got access to quality health care.